fascia, pectoralis major muscle, and the 5 other muscles of the front, that is the pectoral region. Now, we have done the origin, we have done the insertion, we have done the action of all the 5 muscles in the pectoral region. And we were discussing about their nerve supply, which comes from the brachial plexus. And this brachial plexus not only supplies the pectoral region, but all the other muscles of the upper limb. So formation of the brachial plexus is from the C5 to T1 spinal nerves. So this is how we have seen that all of the brachial plexus comes down to the upper limb to supply the muscles, and coming from the cervical region of the neck, and anterior to the cervical region there are various muscles which are called the pre-vertebral muscles. Out of them we have done the scalenus anterior, coming from C3, C4 and C5, inserting one scalenus tubercle, and scalenus medius also inserted on the first rib, posterolateral. All these muscles taking origin from the cervical vertebra, they are covered by a fascia that is called the prevertebral fascia. All the muscles, they are covered by its own fascia. That's why all the muscles, they are separated from each other. Otherwise, muscles, they are very, very rich in blood supply. If there is no sheath or the covering of individual muscle, they may join or they may fuse, and their function may be disrupted. So every muscle is developed with its own sheath or the membrane or the covering, same as the bone also covered by the outermost layer that is called the periosteum. So same is the muscles. So this prevertebral fascia covering the prevertebral muscles, and all the roots of the brachial plexus, they are coming from the cervical region. So as they descend downward, as they are present behind the posterior part of the cervical region, in front of all the prevertebral muscles, so as they emerge out from the intervertebral foramen, they are intimately in relation to the muscles in front of them. So they pierce the muscles, because muscles, they are going already down for their insertion into the ribs or other parts. So these roots, they lie in front of the muscles, and as they descend downward, they bring the prevertebral fascia or drag the prevertebral fascia along with them. So the prevertebral fascia and roots of the muscle, they are nerve are present there. So as they come down, so they bring about their sheath also, and this sheath comes along with the nerve of the brachial plexus. So this is how we have seen that the roots, trunks, division and cords reach the axilla. Below the clavicle in relation to the axillary artery, as axillary artery is also descending down, parallel with the brachial plexus. And we have seen how the relationship with the first part, second part and third part. So this diagram is only to understand a full picture of what is the pectoral region and what is the how the artery and the brachial plexus descend. In the examination, you have to practice this diagram. C5, C6, C7, C8 and T1. So this is the C5 root, C6, C7, C8 and T1. They are the roots of the base. Then every root will divide into two divisions. Before that they form the three trunks. C5 and C6, they unite to form the upper trunk. Similarly, C8 and T1, they unite to form the lower trunk. C7 is alone from the middle trunk. Then every trunk divided into two divisions, anterior and posterior. Anterior division and one is posterior. All posterior divisions unite. To form what is called the posterior cord. The anterior division of the upper trunk and the middle trunk, they unite together to form the lateral cord. But the anterior division of lower trunk is continued as medial cord. So in our hand there are now three cords. And these three cords, they are ready to supply 52 muscles of the upper limb. So we will see how the magic comes and how these three cords are able to supply all 52 muscles. Now comes their branches. Branches of the roots, trunks, divisions, every cord. First, the roots also give the nerves. C5, C6, C7, they unite to form a long nerve that we call the long thoracic nerve. Second name is nerve to serratus anterior. Its third name is nerve of Bell. So you have to remember all the three names of the first nerve of the brachial plexus we are introducing with you, long thoracic nerve. So it is a long because it has to supply 8 digitations of the serratus anterior. So it has to travel a very long course from first rib to the 8th rib. So it is a long. Long is the nerve, long more is the chances of injury. So this nerve is very much injured. So whenever this nerve is injured, then the serratus anterior muscle will be paralyzed. You know, serratus anterior muscle is going backward along with the curvature of the all upper 8 ribs. All 8 upper ribs, they give the serratus anterior, like the fingers, digitation. So this nerve from the root comes down, touching the lateral surface of the serratus anterior and outer border of the all ribs, and supplies till 8th rib. See, that is the long one. And in its journey, there are chances that it may be injured. When this nerve is injured, then it leads to the paralysis of the, whenever the motor nerve is injured. M for M, motor means nerve supplies, formula M to M means, motor means muscle. S to S means any nerve is labeled as sensory means it will supply skin. So Remember the formula, M for M and S for S. So when this muscle is, so whenever the motor nerve is cut due to any reason, then what will happen? Will the muscle will contract? No, because its connection with the CNS is lost. We want to move the muscle, we want to do the action, but it is not responding because it is not contracting. Because its NM junction is not receiving the signals from the CNS. So such a muscle is, what we will use the word paralysis. Underline. Paralysis means total loss of the motor function. Second is paresis. We use two words. Paresis. Paresis means weakness of the muscle. And it is due to the compression neuropathy. Write down compressive neuropathy. In so many nerves, this term we will use. Compressive neuropathy means nerve is compressed or pressed by some tumor or some fractured bone fragments or some organ due to the displacement. So whenever it is compressed, so it is a reversible phenomenon. When you remove the compression, you remove the pressure, you remove the tumor surgically, nerve is released and conduction will be restored and muscle will work fully. But as long as there is a pressure, as long as there is a compression, muscle won't contract fully. It will contract, but the power is very less. Then what we use the word paresis. That is a partial action of the muscle is still possible because nerve is still only pressed. The little bit conduction is hampered, but not fully. So that is how to use the word paresis and paralysis in certain regions. So when this muscle is paralyzed, then what was the action of this muscle? Serratus anterior. Contraction of this muscle keeps the scapula, where it will, scapula will move in which direction? Forward. So when it will move forward, what lies in front? Ribs. So it will touch the, what is this action called? Approximation of the scapula with the thoracic cage or rib. That is the action. You have to write a long sentence. Approximation of the scapula with the ribs or thoracic cage in all movements around the shoulder joint. Or in other words, it is a fixator of the scapula. It fixes the scapula. In all the movements of the humerus around the glenoid cavity, that is the function. So it gives the stability. And it makes the movements of the humerus or shoulder joint purposeful. Otherwise, the movements won't be proper. If the scapula is tilting or is moving, it gives the fixation is the first term used for the scapula. So now it is paralyzed. Now it no longer is, now it is touching the ribs. Actually, when the muscles they are not acting, even then, all the skeletal muscles in the, when we are awake, when we are not sleeping, all the muscles they are in a slight state of the muscle contraction. They are not relaxed. They are only relaxed when we got sleep. Then all the muscles they also relax. There is no any contraction. Flaccidity is there. That use the word flaccid. So all the muscles they remain in a slight state of the contraction, and this is called the, what we use the word term for this, tone of the muscle. Tonicity. The tone of the muscle. Now tone is lost. Long thoracic nerve of belly is damaged. Then what will happen? Scapula will no longer be touching the ribs. It is no longer touching the thoracic cage. What will happen then? How the patient come with? Medial border of the scapula is raised above the surface. The medial border of the scapula. The medial border of the scapula is no longer touching the ribs, and what will happen? If you see on the back side, normally when you put your hand behind the patient, to see the medial border of the scapula, it is not felt. It is merged with the surface. But in this case, when the nerve of bell is damaged, what will happen? The medial border is raised above the surface. Now it draws back. It will fall back. It is no longer touching the ribs. So what will happen? Medial border is prominent. It becomes prominent, and this prominence of the medial border is called winging of the scapula. Winging. So this is the applied anatomy of the long thoracic nerve. Winging of scapula. Winging means like the wings of the pigeon. Pigeon wing. So that is called the winging. Not Punjabi word winga ho gaya. Winga means straight up. Winging of the scapula means it is bird-like. Bird-like appearance. That is called the winging of the scapula. So this is a nerve to this. Then the multiple small nerves C5, C6, C7, C8, they give from the directly from the roots from the neighboring. Some muscles are there which are supplied by them. They are small muscles in relation to the around the intervertebral foramen, so they supply them. Then comes the nerves of the trunk. Upper trunk, middle trunk, and lower trunk. So very important, two nerves are given by the upper trunk. One is called suprascapular nerve, one is called the nerve to subclavius. Upper one is called the suprascapular nerve, and below is called the nerve to subclavius. Same muscle we have done with the first rib. Subclavius, sub means below, clavius means clavicle. Subclavian groove, if you remember the clavicle. Nerve to subclavius is the branch of the upper trunk. Suprascapular nerve is the branch of, again, upper trunk. And this region lies somewhere there. Suprascapular nerve comes from there and it will reach the upper part of the scapula and pass it to the suprascapular foramen. And this is the clavicle medial end. This is the first rib here, like the subclavius muscle. The nerve from the subclavius, it descends down, very long course, and then it supplies the subclavius. So this is the uppermost part of the brachial plexus, the upper trunk. Uppermost, and it lies just below the skin, superficial fascia, and deep fascia. So it is liable to be injured. This point is liable to be injured very frequently because it is superficial in position. Plus it is giving two nerves supplying three muscles. So this point of the brachial plexus is very important area that is called the Urs point. This area is called the Urs point. Urs got the name of a scientist who discovered it, the Urs point of the brachial plexus. So it lies just here, the middle of the angle between the neck and the shoulder. This is the angle between the neck and the shoulder, and it lies in the middle of it. So it is very much liable to be injured by the direct injury or by the bullet injury. If the bullet is coming and it is just going and touching this point and goes back, but it has injured the Urs point. It may not hit into it, but it has just passed by the Urs point and it is damaged. Direct cut injury by the knife injury. Tumor may be there around this area, may press it. So there are so many causes. Anything which increases the angle between the shoulder and the neck will stretch this root from the spinal cord, and this point is there. The stretching may be there because of the lifting the heavy loads by the potters and repeated, or during the difficult vaginal delivery, when the head of the baby is large, pelvis of the female is small, then drawing the breech presentation may arrest the head of the baby in the pelvis, and a forceful traction of the baby will increase the angle between the neck and shoulder. It will tear the earth bone, and a baby will be born with the earth paralysis. The applied anatomy of the earth point is it leads to a very typical type of the upper limb paralysis that is called the earth paralysis. Earth paralysis. So a large number of the muscles whose root value is C5 and C6 will be affected. If some muscles they are having the root value of the nerve supplying them is only C5 and C6 will be totally paralyzed. Those nerves whose root value is C5 and C6 plus something else also, those muscles will be paresis. Is it clear? What is paresis? What is paralysis? So you have to enlist the muscles who are paralyzed and enlist the muscles which are under paresis. This question we will see the answer in last of the upper limb when we do all 52 muscles. Then only you can understand which muscle and which action will be hampered. At present you should know there is a point is there where 6 nerves meet. Say 6 nerves meeting place, underline it. 6 nerves. What are those 6 nerves? Write down. Number 1, root of C5. Number 2, root of C6. Number 3, suprascapular nerve. Number 4, nerve to subclavius. Number 5, anterior division of the upper trunk. And last 6 is the posterior division of upper trunk. 6 nerve meeting place is called the earth point. And this damage lead to a large number of the muscles undergo paralysis or paresis. That you have to write down. About 6 pages question. Answer is this. And we will do in the last when we do the finish with the upper limb. Then you will came to understand that how it is possible. Then comes the nerves of the rest of the brachial plexus. The lateral cord gives a nerve which is called lateral pectoral nerve. Similarly, medial cord also gives a nerve that is called the medial pectoral nerve. The 2 pectoral nerves are given by the cords. Now the answers are the cords. Branches of the cords now start. So medial pectoral nerve will supply small muscle, that is the pectoralis minor. As pectoralis major is a large muscle, it is supplied by 2 nerves, both lateral pectoral nerve as well as because it is large in size. So that is how we do the muscles of the and nerve supply from the cords are coming. Then next branches the nerves which are coming. The lateral cord gives a lateral branch or a lateral root. Medial cord is also gives a medial root. Both the lateral root and medial root coming from the lateral and medial cord respectively, they unite to form a nerve which is called median nerve. This is median. How it is formed? By 2 roots. Medial root from the medial cord, lateral root from lateral cord. They unite to form the median. And this median nerve relation is very, very important. This nerve is formed lateral to the axillary artery. Lateral to the third part of the axillary artery. So it is formed somewhere here. The third part is so long. So it is formed from the lateral root, from the lateral cord, and medial cord, medial root. It is formed lateral to the artery. Then it crosses in front of the axillary artery, and then it accompanies the brachial artery medially. So this is formation and the crossing over to the medial side. Median nerve. That you have to remember the course of the median nerve. Then after giving the lateral root of the median nerve, this lateral cord is continued as musculocutaneous nerve. Its name changes now. Musculocutaneous nerve. Muscular means it supplies the muscles, and after supplying the muscles it becomes cutaneous or sensory. So it is a mixed nerve having both the motor as well as the sensory component. That's why its name is musculocutaneous. It is the lateral most nerve of the brachial plexus. Lateral most. And the medial most muscle, medial most nerve. Medial most nerve is the ulnar nerve. As you know, ulnar bone is the medial bone of the forearm. The nerve which is coming from medial cord is continued as the ulnar nerve. Before becoming the ulnar nerve, the medial cord gives one branch that is called the medial pectoral nerve. Number 2 branch it gives the medial root of the median nerve. Third branch it is giving is called the medial cutaneous nerve of the arm, and one more nerve is giving medial cutaneous nerve of the forearm. So it gives the 4 branches. So medial cord gives 4 branches. You have to write down 4 branches. Number 1, medial pectoral nerve. Number 2, medial root of the median nerve. Number 3, medial cutaneous nerve of the arm, and the 4th is the medial cutaneous nerve of the forearm. So this brachial plexus is the backbone of the upper limb. All the branches you have to be on fingertips. Then only you can understand the dissection part of the upper limb as well as the nerve supply and the course, because all the important nerves are important. Median nerve, musculocutaneous nerve, ulnar nerve, everything is important. So now comes the posterior cord. Posterior cord, as we know, it is formed by the posterior divisions of all the 3 trunks. Now it also gives branches. One branch is given is called the axillary nerve. It also gives 4 branches. Remember, medial cord is also giving 4 branches. It is also giving 4 branches. One is axillary nerve. Second branch is called the upper subscapular nerve. Then it also gives the lower. Third is the lower subscapular nerve. And in between the 2 is the thoracodorsal nerve. Thoracodorsal nerve, or its other name is nerve to latissimus dorsi. Nerve to latissimus dorsi. So this is the full picture of the brachial plexus. You have to draw and label this brachial plexus before going to the upper limb 10 times, 40 times, 50 times, then it will be thorough. Because without this diagram, you can't understand what is the upper limb. So this is how the picture of the brachial plexus in the exam you have to prepare. This, not this. This is not possible for you to draw this. You have to only practice this so many times. So what is the root value? For example, I want to know what is the root value of the long thoracic nerve. Take this nerve and go up. See from where it is coming. C7, C6. How it is formed by C5? The root value is C5, C6, C7. I want to know the root value of the suprascapular nerve. Go back from where the fibers are coming. One is coming from C5, one is coming from C6. So what is the root value of suprascapular nerve? C5 and C6. If I want to know what is the root value of the median nerve, see how it is formed. It is coming from, fibers are coming from C5 plus C6 plus C7 plus C8 and plus C1. So its root value is C5, C6, C7, C8 and C1. This is how to remember. And this is only possible if you know this diagram. But ratification is not possible. You have to be thorough and theoretical.